Today we will discuss about head and neck cancer. Cancers which are commonly occurs in head and neck area. As you all know that the head and neck cancer is the most common cancer in India, and head and neck cancer occurs most commonly in Indian peoples because we have some particular habits. That's why we have most highest cancer cases of head and neck cancer in world. We have approximately 2 lakh cases per year in India, and this incidence is much more common than the Western countries. So today we will discuss what is the signs and symptom of head and neck cancer, how we can diagnose the head and neck cancer. If you have head and neck cancer, then how you can get rid of these type of cancers, and how we can go through to prevent these cancers. So first of all, we discuss about the signs and symptoms. And if you have any type of lump in head and neck area, especially in the neck area, or if you have any change in your voice which is somewhat different than in previous voice, and if you have any type of chronic non-healing ulcer in your mouth, or if you have any abnormal swelling in your face or in your eyes or in your ear, or if you have a long running pain in ear or in these particular areas, then you should be alert. And if you have such type of any sign and symptom, then you immediately go to your doctor for examination and to rule out either this is not the sign or symptoms of the cancer. These signs and symptoms may occur in different type of diseases, but one of the cause is the cancer. So you should be alert and you should go to your doctor immediately if you have such type of symptoms. And when you go to your doctor, then your doctor will be examine clinically of these areas which were affected by these symptoms, and he needs some type of investigation to rule out the cancer. So if he found any non-healing ulcer or any abnormal swelling, then he will do some clinical examination by which he differentiate either this is by the cancer or by other particular causes. Particularly the tuberculosis is much more common in India. Then in neck swelling is may also occurs in the tuberculosis. And after the clinical examination, he will advise you some investigations like radiological investigation like X-ray or head or CT scan, and if needed, then he will finally diagnose cancer by the tissue diagnosis. It means he will took some tissue of that abnormal area and he will send for the pathology, and by this he will diagnose head and neck cancer. And if you have head and neck cancer, you will, or either you will diagnose head and neck cancer, then there is no need to worry, because if it was diagnosed in the early stage like in stage 1st and 2nd, then there are high chances of cure even without deteriorating your quality of life. So early diagnosis is very much important. By diagnosis in early stage, there are much more chances of cure from this disease, and there are also less deterioration in the quality of life or in your figuring. So the early diagnosis is very much important. And after the diagnosis, there are many treatment of head and neck cancer, and most common is surgery, second one is radiotherapy, and third one is chemotherapy. If lump is larger, then doctor may give you chemotherapy to decrease the size of lump, and then he will give definitive radiotherapy or surgery. And if lump is smaller, then he can directly go through the surgery or radiotherapy, and there are much more chances of cure of this cancer. And if you think that what is the causes of cancer and which type of lifestyle we can prevent these cancers, then the most important is you change your lifestyle. You will keep away from smoking, and in India we have different type of smoking like bidi, cigarette, and hookahs, and we also have some smokeless tobacco, especially in North India, and most common is zarda and various type of pudiyas. And if we can prevent these things, then we have very less chances of head and neck cancer. Second one is alcohol consumption. No limit of alcohol is safer for cancer, so we have to avoid alcohol consumption. And third one is spicy food, because if you use spicy food for a long time, there is chronic irritation in your oral cavity, and there are more chances of malignancies in your oral cavity. And another cause is chronic irritation by either your ill fit denture, especially in older persons, and there may be some chances of your teeth which may cause chronic ulcer to your mouth. So if you have chronic ulcer due to your teeth, then you immediately go to dentist, and dentist may change some size and shape of the teeth to prevent your chronic ulceration, and if this is not possible, then he can extract that tooth. And it is very important that if there is no chronic irritation, then there are very less chance of malignancies. And last one is your hygiene of the oral cavity. If your hygiene is not good, then there are much more chances of cancer. So we by preventing from alcohol, tobacco, and by with the good quality of good oral cavity habit, that we can prevent cancer. And if you have cancer, then there are no need to worry. You can go your doctor, and if you diagnose in early stage, then you can get it off from your cancer. And if you have diagnosed in late stage, then unfortunately in India approximately 60 to 70% cases will diagnose in the late stage. Then there are also chances of cure from this malignancy. You immediately go to your doctor, you follow instruction of your doctor, and there are chances of to improve from the head and neck cancer. So we all, by awareing these type of symptom in society, we can prevent head and neck cancer, and by preventing these head and neck cancer, we can improve quality of life our Indian peoples, as well as we can help developing our country by improving quality of life of our peoples. Thank you.